Good evening, and welcome to the Wellness Watch presented by the African American Wellness Project, also here on blackdoctor.org. I am your open guy, also known as the co-host, Ellis Dean, as we have a fun-filled and packed show full of information, great information for you and your family. Tonight, I'm very, very excited about the guests that we have and the topics that we're going to be talking about tonight. We are going to talk about what's going on with the vaccine situation and the recent news about Johnson & Johnson. So we're going to discuss that briefly to give you some of the latest information that you can need for your family. And we're also going to try to assuage some of the apprehension that you might be having about that particular vaccine and the stoppage that has been recently happening. We also have a big show tonight. We're going to be talking about asthma, and we've got some wonderful, wonderful guests that are going to come on and really kind of help you understand the impetus of asthma and how you treat it, things that you can do. And we're also going to be talking about allergies. It is allergy season, and I am an allergy sufferer. I get the pollen, serious sneezes, I get the whole nine, you can say the whole shebang-a-bang. So we're going to talk about asthma and allergies tonight. That is our main topic for tonight. But we're going to start with a little bit of COVID vaccine talk. So I'm going to stop my filibuster here, and I'm going to bring on the man of the hour, and that is the incomparable Dr. Michael Lenoir.
I still just want to know why I'm only the man of the hour. You know what I mean?
That's no longer on the show, Doc.
Man, maybe the man of the day of the week.
Well, the show's an hour, so I say you're the man of the hour. So, you know, if we want to make it a man of the day, I can't do a day-long show. I can only do an hour-long show. So you're going to be the man of this hour for me. I got 24 hours in a day.
I want to welcome our audience to our special program today. You know, the Wellness Watch is sponsored by the African American Wellness Project. And we try to cover a lot of ground, but we have certain passions. And one of our passions is for asthma, and one of our passions is for allergy. And so we sometimes will disproportionately try to give you as much information as we can, because we know that there's so many people who suffer unnecessarily from both of these problems. Sometimes people suffer unnecessarily from asthma because they don't have the information. And so we're focusing tonight not just so much on the treatment, the individual treatments, but on the information systems and where you can get the kind of information that you might need in order to successfully manage yourself and your family with asthma. And we expect, and we want you to ask questions. And then we're also going to spend a great deal of time today on allergy. This is allergy season in most parts of the country. I can tell you as an allergist, this is a very busy season for us. And I'm sure there are a lot of you suffering out there from allergies unnecessarily as well, like Mr. Ellis-Dean, who would keep as an example of someone who could take better care of himself, especially where allergy is concerned. And so we're going to do that. But first, I think we need to discuss the issue that's come up this week around the Johnson & Johnson vaccine and the thrombosis that seems to have occurred in 6 women between the ages, I think, of 34 and 48. Somewhere
18 to 48. They were between the ages of 18 and 48. 6 women, yes.
Even though it's only 6 cases, it still gives us a pause. And so much pause that the task force has decided to halt the use of the J&J vaccine until it's further investigated. I think that there certainly seems to be a dark side, because we were gaining momentum in every community around the vaccine because of its safety in the other 2 vaccines. And 6 in a million is unfortunate, especially if you're one of the 6. But it's certainly not so significant that many of you who've gotten that vaccine have to worry as much as you might think, and until it's been worked out. I think the best face was put on it today by Dr. Fauci when he said that the upside of this is that it shows you that the science is working, that people are monitoring this in such a detailed fashion that we're able to catch this, even though it's a very small percentage, and it could probably be worked out. If it works out that this is coincidental or this is just an aberration, the vaccine will be back on the market pretty quickly. If the vaccine has to be changed, obviously that's going to be a whole different thing. And so consequently, I think that we still have to get vaccinated. I think African Americans have increased their percentage only from of the 60 million people vaccinated, only 9% are African Americans. And so consequently, we really need to start to think about this a little differently. And so with that, I'd like to introduce our first guest, Ms. Tonya Winder. She is the president and the chief executive officer of the Allergy and Asthma Network. And the reason we're talking with Ms. Winder is because of not only their work in the area of asthma, but their work in the area of COVID and their work in underserved communities as well, because I think it's important to know that, but also to know where your resources are when you have problems with asthma and allergy, where you can go to get just about every single resource you need to do what you can do to take care of your problems. So welcome to our program, Ms. Winder. Welcome to the Wellness Watch, and we're glad to have you, and thank you for joining us.
Thank you for having me. Appreciate it.
Let's begin at the beginning. How did the Allergy and Asthma Network get started, and how did you get involved?
Well, Allergy and Asthma Network actually was started by a mom who was looking back in 1985 for good guidelines-based approaches to managing her own child's disease. She had a daughter with very severe asthma as well as food allergies. So she was sitting at her kitchen table long before we all had the internet at our fingertips and was doing some research. Then she began writing a newsletter that was shared in the Kaiser clinic that she was being seen in. And ultimately that got some national attention, and that's how Allergy and Asthma Network was first born as Mothers of Asthmatics. And I myself became involved about 15 years ago as a mom and a volunteer. I'm the mom of 5. 4 of them have allergies, asthma, eczema, all of those types of diseases. And so I began volunteering and working with Allergy and Asthma Network. And then 8.5 years ago, the founder, Nancy Sander, retired after 28 years of service, and I became the CEO and president. So I've been serving in this role for the last 8 years.
Now, tell us how, over the period of time, how your work has changed from when you started. Hello?
Sure. Well, the fact of the matter is that our mission has not changed. So since 1985, we've been dedicated to ending needless death and suffering due to asthma, allergies, and related conditions. And we do that in 4 key ways. The first is outreach, where we're driving awareness of these diseases. We do that through traditional media, social media, digital media. Of course, all those things are new, right? Because those weren't around in 1985 in the same way. The second area is education. We do education for patients and caregivers, but also for healthcare professionals. So webinars, newsletters, continuing education programs, live events that we're going to talk a little bit more about in the community. These are all ways that we convey those educational messages in a patient-friendly manner. The third area is advocacy. So advocacy for the network. Oh, yeah. Sorry?
No, go ahead. Advocacy.
I'm so sorry. I thought there was a question. Okay. Yeah, I was just going to say advocacy, which is really just working to ensure that patients' voices are heard and that we have access to the care and the treatment that we need. So that's doing that at the state and at the federal level. And we've done that through things like our Allergy Asthma Day on Capitol Hill, through passing bills. Even today, we had a bill that was passed through Congress and to ensure safe labeling of food for those that are living with food allergies. And then the final mission area is research. So outreach, education, advocacy, and research. And research for us is giving patient insights, ensuring diversity and inclusion in clinical trials, and certainly also doing a lot of focus groups and survey work where we have publications in peer-reviewed literature.
As a mom, as an advocate, and as the leader of one of the nation's most important asthma and allergy networks, how can you share with our audience how important simple information is in managing difficult asthma problems? I think when people start thinking about and talking to us about asthma, they always want to talk about the drugs. But really, I think having a comprehensive picture of what asthma is like and understanding the dynamics and the triggers and getting as much extra information as you need is, in my estimation, as important as the medicines. What say you about that?
Well, I absolutely agree. And I think it all does start with that appropriate and accurate diagnosis. And so what does that mean? Number one, it's not one size fits all. So not every patient with asthma has the same type of asthma, nor do they have the same triggers or things that make their asthma worse. So working with your provider, working with your healthcare professional to actually understand what type of asthma you have and what those triggers are and how you might be able to manage them more comprehensively is a key aspect to long-term asthma management.
So what do you say to people who say, well, you know I'm allergic to dust. But that couldn't be that important that I get rid of that trigger. Or I know that, the cat is a problem, but, I don't see how it contributes. I noticed that in the new guidelines for managing asthma, understanding the triggers is right up there with the biologics and the changes in the new medications. Has that been your experience in terms of dealing with people, that we don't often pay enough information, enough attention to those things that trigger the problem and focus really on the symptom more than the whole cascade of the disease?
It is. It's so vitally important that we get to those underlying causes of the inflammation and the disease process. And oftentimes we do hear from families who say, I'm sorry, I'd rather live with allergies or asthma than get rid of my dog or my cat. And we understand that because pets can certainly become a very important part of the family. But there are critical steps that one can take, keeping it out of the bedroom, making sure that they're bathed on a weekly basis, certainly taking allergy medication or allergy immunotherapy with a board-certified allergist. These are all steps that you can take to manage those underlying allergies that could be making your asthma worse.
One of the things we focus on with Wellness Watch and the African American Wellness Project is we focus on the whole issue of advocacy. And advocates. We focus on trying to get people to understand how to navigate the system in order to better care for any chronic disease, especially asthma. I don't want to put you on the spot, but how important is it for those of our parents out there to try and get with a provider or a specialist who actually understands the disease, understands the problem, and keeps up with it? I see in my own practice every day, and as you know, probably the statistics as well as I, there are very few Black allergists in this country and very few Black specialists who deal with asthma. And when I see some of the cases of children and adults that I've seen who are unnecessarily sick, either in the emergency room all the time or in the hospital, because the system that they were in did not understand the dynamics of managing the problem. How often do you think that is a problem for our parents or for people who are listening with asthma? Because it's my feeling, and I could be wrong about this, that most serious asthma that ends up in the emergency room and the hospital is really preventable.
I would agree with you. I think that, so there are about 26 million people in the United States living with asthma. And we certainly know that people of color, African Americans, Black Americans, Native Americans, as well as Hispanics and Latinos are more likely to have worse outcomes when it comes to asthma. Part of that is because they aren't getting that appropriate level of care. And so unfortunately, we hear all the time of patients that have been, mismanaged. Oftentimes it is that they are not getting that appropriate, accurate diagnosis that includes evaluation of their allergies, that includes their evaluation of other non-allergic triggers that may be making their symptoms worse. But it also can be just having a more open, trusting, shared decision-making process with their provider. If you're only getting 2 or 3 minutes with your doctor and you're not talking about all of the things that are really important to you in managing your asthma, or the things that asthma is keeping you from doing that you desire to do, then we really encourage you to step that level of care up and seek out the advice of a board-certified allergist or pulmonologist, depending on the needs.
Before we move on to your work in the COVID space, tell us a little bit about what people can expect. Well, first of all, tell us what people can expect when they go to the site for Allergy and Asthma Network, and tell us about your work since Dr. Graham is here, probably through some fault of mine, he's not here, about your work with Not One More Life.
Sure. Well, so our website, allergyasthmanetwork.org, has just recently been revised, and it's much more user-friendly. There's a wealth of information about allergy, asthma, eczema, COPD, so many different types of conditions that often cluster in the allergy asthma space. So a wealth of information, but very easy to understand and digest. As far as the Not One More Life program, that is a specific program under Allergy and Asthma Network that has been in existence for over 20 years. Started in Atlanta, Georgia by Dr. Leroy Graham, a pediatric pulmonologist who saw the disparities and the inequities in the Black community specifically. And so he began partnering with churches in those communities to do asthma clinics, asthma screenings. And we at the network have taken that work forward and have been doing COVID testing and COVID screenings throughout the greater Atlanta metro area, and are now expanding that program to about 10 different cities throughout the country in 2021.
Well, that is wonderful. Being in the Atlanta area, I am very, very happy to know that it started here in Georgia. Could you talk in terms of allergies in particular? I've noticed that I'm from Florida originally, and I noticed that when I go back to visit, my allergies aren't nearly as intense as they are than when I am here in Georgia. Is there some correlation between being in an area where, like, growing up in a place that your body has adjusted to the pollens or to the allergens in that area versus another city or state or region of the country?
Absolutely. So again, it takes our bodies being repeatedly introduced to these offending allergens for us to even know if in fact we are allergic. And again, it's when our bodies produce an antibody called IgE that actually makes all those symptoms of the runny nose, itchy eyes, scratchy throat, sneezing, all of that good stuff that comes along with allergies.
Have you been watching me today? Did you stop?
I know. Yes, actually, it's rampant all over the country. The phones are ringing off the wall this year.
Yes.
But the good thing about this year is that we're wearing masks, right? And as we're wearing those masks, it is covering the nose and the mouth. And so we're getting fewer exposure to allergens if we are wearing masks. So there's a double benefit there of COVID and allergies. But nonetheless, there are different allergies that are more prominent in different areas of the country. And so the allergens that you were exposed to in Florida are different than the allergens that you're exposed to in Georgia. And what we're also seeing is that our climate's changing. So allergies are strong out, and the allergens are stronger. The allergy seasons are longer. And so the symptoms are worse as, we continue to move forward in history. And so that's why, again, you may not have the same allergies when you're in Florida versus Georgia.
Wow. Okay. So look, now that Dr. Lenoir, I snuck it in here to say, okay, all right. So I ask some questions. So I have been told, and so that I'm going to go with a wives' tale, that if, like what we're talking about in different regions and different areas,
Yeah.
if I started getting Georgia honey and just a teaspoon of honey that has the pollen in it, that'll help my body kind of process better to be able to resist some of the allergens. I might still be susceptible to it, but it'll help me resist and build up some resistance to some of the allergens. Is that true?
Yeah. So, the reality is we don't have data. Okay. So there is no scientific proof that that is true. But what I would say is that I know people that swear by it, that take a spoonful of local honey every day and say that it definitely helps manage their symptoms. And so who am I to, negate their own personal experience? But what we do know that is the way we desensitize patients oftentimes is by giving them a measured dose of that allergen that they're actually allergic to, and teaching their body to become more accustomed to it. So that's called allergen immunotherapy or desensitization.
Okay, so maybe I'll try that.
It can hurt. I mean, honey is good for whatever ails you. So
that's true. But also, I think ultimately, if you believe it, then it has a better chance of working, right? So if you believe it's going to work, then it's going to work better than it did if you're kind of apprehensive about it. So sometimes our own kind of mental approach to things really helps the efficacy of a particular treatment.
That's right. We call that the placebo effect, right?
Placebo effect, absolutely.
Something that has no therapeutic or clinical value, if we think we're getting better or we think we're getting medicine, that we might have improvement.
Absolutely.
Our minds are a powerful thing, for sure.
Yes, they are. So, all right. So I got another question. So we have a pet. We have a dog. No problem. Don't have any problems with it. But my sister and my uncle, they have cats.
Yes.
And I am really allergic to cats. And so help me understand how that mechanism works as much as you can in terms of why am I allergic to one type of pet versus another type of pet?
Yeah. So it's all about the pet's dander. And so a lot of times people think it's their fur or, but it's actually the dander, the very, very small pieces of their skin that flakes off. And oftentimes they lick and then they lick you and that's how you become exposed. So cat dander and dog dander are two very different proteins and your body recognizes them completely differently. Cat dander is really interesting. There's a lot of really fascinating studies that even decades after the cat has been removed from the home, there's still cat dander in the home.
Wow.
So it's very sticky and hard to get rid of. So that's oftentimes why you'll hear people say, well, you've got to remove the carpets or you need to completely keep the cat out of the bedroom, because that dander is there and that's what your body is reacting to. But you bring up a good point, Ellis, because allergies and asthma have both a genetic component. So, depending on your mom, your grandma, your dad, grandpa, aunts, uncles, all of that, there is a genetic predisposition, but then your environment. And we know that each person has a unique genetic makeup and environmental component of their disease.
So are you saying I should move to Arizona to that nice, dry, clear environment?
Well, I would probably say that it depends. Who knows? You might find new allergens in Arizona. So
I'll be moving back to Florida. My body's accustomed to that. I'm going to move back to Florida.
I didn't think we had.
We're glad to have you back.
I didn't think we had enough drama in the program, so I thought maybe I would inject that. But let me say one thing about animals while we're talking about it, and then we'll get back to some of the other issues. I'm not a great animal fan. I don't want them killed I don't want them on coats, but I have never seen anybody ever give up an animal, no matter how sick they were, with allergies. Never.
They'll get rid of the husband before they get rid of the cat.
I've seen marriages break up. I've seen all kinds of partnerships break up. Because when it comes to a decision between you and the cat, that's an irreversible, that's a statement. If you say the cat can stay and you can stay sick, that's a statement. But I've never seen people give up animals. I'm sorry to have lost contact for just a minute. Can you just give us a brief overview of the kind of things that you're doing now in the area of COVID testing and management?
Well, just like everyone else on the call, March of 2020 brought major changes to Allergy and Asthma Network because our community, those living with allergy, asthma, and compromised immune systems, actually had a lot of questions. So we began offering COVID-19 information webinars on a biweekly basis. We've now held 26 webinars. We've had over 200,000 people join for those webinars. And we've developed frequently asked questions, infographics, a whole COVID-19 information center that you can go online at allergyasthmanetwork.org COVID-19 and find a wealth of free information and resources, as well as the playbacks of those webinars. But we thought that wasn't enough. And in the summer, when everything came into the spotlight of the inequities and disparities in our country, we saw it as a wonderful opportunity to bring the Not One More Life program forward and include COVID testing in those underserved communities, and to make sure that the Black community specifically had at least equal, if not better, access to testing and vaccine. And so that's where we started. And again, we did 1,200 COVID tests in downtown Atlanta. And then we identified 156 of those people who had uncontrolled asthma and or COPD. We then invited them to do a 16-week telehealth, digital health program, and have supported those 73 of those individuals for the last 16 weeks. So we just completed that 16-week intervention and follow-up. And now, like I said earlier, we're beginning to expand to areas like DC, Maryland, Virginia, Oakland, Chicago, Birmingham, New Orleans. We've got a whole list of additional cities we'll be going to this year.
Well, so I think that Dr. Leroy Graham, I'm sorry he's not here with us, has also been a partner in this whole process. And I think that rather than just talking about the issue, I think the Asthma Allergy Network, along with Not One More Life, has really put themselves into the community in a way that I think is important. I keep emphasizing to those of you who have asthma or whose children have asthma, if your children are not well controlled, if you're not well controlled, then something is wrong with the system that you're in. Because there's so many things that we can do now with asthma. And the Allergy and Asthma Network is a great resource in a number of ways, and I hope that we've done justice to the kinds of work that you're doing and the opportunities that you present for people with asthma and allergy to do better. As Dr. Watson always said, if you knew better, you do better. And I think our community is really good about that. Too often we don't get the information we need, we don't get the resources we need. But I think here on Wellness Watch and in the next few weeks, we will continue to talk to you about the programs that you're doing, and certainly the webinars I think are very important, and they will be on our website as well. So let's just take another leap now and start to talk about allergies, because this is allergy season, as we call it in most places. I always say, you sneezing and wheezing, it's allergy season. So that we are now going to talk a little bit about some of the things that you can do in order to be better prepared for the allergy season. When I first started in practice, there were virtually no really good medicines for asthma without significant side effects, and for allergies. And now that's changed so dramatically. And so that we want to get your questions in. That's what the Wellness Watch is all about. And we'd ask Ms. Winders to stay because there's a piece of this that her network has to deal with on a more regular basis. And so let's talk a little bit about what happens now. We call it allergy season because it's really pollen season. The pollen season is different in different places. I mean, California is a funny place in that sense because our seasons are so different from the seasons on the East Coast. Our season started in January with the tree pollen and go into April and May with the grass pollen. We don't have ragweed here in California, so we have a very, very small weed season. I don't know why we don't have it. We have everything else in California, but maybe because it's such a perfect state, we didn't allow ragweed to come into the mix.
Oh my gosh, I think he needs to drop back off again, Talia. I'm sorry. He needs to drop back off.
Now he's doing some cold here.
But on the East Coast, you obviously have two major seasons. You have the pollen season, which is not as long as ours, but certainly more intense, and you have the ragweed season. And so consequently, there are lots of things that we can do now and lots of things that you can do for yourselves. So if you've got questions, put them in the chat room and let's talk about it. Let's talk about how we approach this particular period of time. In most of the instances that we talk about allergy, we're really talking about what you can do to reduce your exposure to triggers. Certainly that's true with food, that's true with environmental allergens like house dust and mold. But you can't avoid pollen. I mean, pollen is just going to be, and it's not your pollen on your street. It's the pollen next door that's blowing into you. So there's not much you can do in terms of pollen, but there are a few things that you can do, especially for children, because they tend to get sick, much sicker more quickly. Certainly, during pollen season, you can take care of your other allergies. That's the first thing. You got a house dust allergy, food allergy, you've got an animal allergy. You need to be extra diligent about doing the environmental things that you need to do.
Well, how can we help with the house dust allergies? Is there something that I can buy? Is there something that I can put in my home? Do I need to get a cleaning service? What do I need to do? Because I'm not doing it. So what can I do to reduce the house dust in my home?
Well, I think the first thing you have to say, especially in our culture, that a house can be clean and still not dust free. So when we ask you about house dust and things we ask to do, we're not saying your house is not clean. I know your house is clean, but that has very little to do with how dust accumulates. When we talk about dust, we're talking about the house dust mite. It's all you see it sometimes on the testing you get called dermatophagoides. It's ubiquitous. It's all over the world. It lives in if you saw it, it scares you in the big picture. But it lives in the very small spaces above the floor where your humidity is a little greater. And so consequently, we're talking about what can we do? Well, practically speaking, you could spend a lifetime just simply doing house dust controls. But you have other things to do. So we focus primarily on the bedroom because that's where you spend a large majority of your time. And so then we look at the bedroom in several ways. We look at the bed first. And the pillow and the mattress. And we ask that those of you who have house dust problems get pillow and mattress covers. You can get them from Costco. You can get them from Walmart. They're not that expensive, of course. You can get everything from Amazon. And so consequently, I think getting pillow and mattress covers that are non-allergic is one of the first essential things. And then I ask you to get rid of everything in your bedroom that you don't need in there, because everything has the capacity to collect dust. And so, those trophies you won, the books that you're reading, the clothes that you wear should not be in your bedroom if you have a major problem with house dust. And then,
Ellis,
of course,
you really have to get rid of your teddy bear because stuffed animals would be the worst.
Yeah, get rid of that. Get rid of those trophies.
I'm not getting rid of my teddy bear. It would be too long. I'm not getting rid of it. So this is what we're talking about.
There's that picture of the house dust mite. I mean, when you see this picture, it motivates you, I think, to go do something to reduce your exposure to house dust. And so that was a good. That's a good picture, but it's in every home. But it's in your bedroom, and that's where you spend the large majority of your time. And so doing something.
I'm not going to sleep now, Dr. Lenoir. I'm not going to sleep. I'm going to be like germaphobe, spraying everything down, because if those things are in my bed, I'm not getting in there.
But I've had patients who couldn't sleep once they saw that picture. But in any event, I think you'd have to realize that anything with a lot of corners, anything with a lot of edges can collect dust. And so I think that that's one thing. You can take it as far as you like. There's some YouTube videos on how to do dust control that would keep you going every day, all day, just taking care of the dust. But if you focus on the pillow, the mattress, getting rid of as many things in your bedroom as possible, then I think that that's the first place to start. I think the next thing that we talk about is whether or not to get one of those filters. I think it's catch as catch can on that. HEPA filters do help some people. Particle sizes need to be smaller. I think if you really want to do it right, you have to put something in your heating system or your air conditioning system in order to be more effective with dust. Tonya, anything you want to say about dust?
Well, you made some great points. I think the main thing is to remember that there are some really valuable coverings for your pillows or for your mattresses that, if you know that you're allergic to dust mite, are very effective at keeping those at a minimum. Also, washing your sheets and your bedding in hot water or freezing the teddy bear. You don't have to get rid of your teddy bear, but you do need to put it in either hot water or freeze it in the freezer in a bag, in an airtight bag, to really kill off those dust mites.
And so that's
it
one
just
of the
feels
first
like so cruel. That just seems so cruel to the teddy bear.
I know, poor Teddy.
Well, and then when we talk about pollen, there are some things that you can do. Make sure that your windows are sealed. Make sure that you're washing your clothes when you come in from outside. Make sure you're washing your pets when they come in from outside. There are all kinds of ways in which you can kind of seal off that house. And look at the pollen counts. When the pollen counts are really high, then that's not the time to play baseball or basketball or be outside for picnics unless you're prepared in other ways. And so consequently, I think during pollen season, there are some things that I think you can find on the website that you can do. Would you agree, Tonya?
Absolutely. I think, some of the key things that we say is pay attention to the time of day, because again, the pollens, there are times of day when the pollens are worse than other times. So that might be the time that you go out for a run or choose to go out and take a walk. Also, we often say, be sure to jump in the shower before bed at peak pollen time, because that at least gets the pollens washed off of your skin and your hair, and then you're not getting in your bed and inhaling those pollens all night long. Get those dirty clothes out of the bedroom. These are, very pragmatic, practical ways that you can reduce your exposure to pollens.
What about medications? Are there some good over-the-counter medications that can offer some sort of relief? I know I take, my go-to is Zyrtec, so I do take that. We don't get any money from them. For me, I'm not trying to endorse Zyrtec. I'm just saying what I use personally, and I like the D, which is the Zyrtec D. It's got the decongestant on there, which kind of helps clear out the nasal passages. Now, I do know that the D is tougher to get because you have to go show your ID at the pharmacy. They don't have it just out on the counter anymore, and that's just because of methamphetamine manufacturing has kind of that pseudoephedrine. You can say it better than I can, that they use to make methamphetamines is in those medications, and so they have moved them to behind the pharmacy counter. So you do have to be more deliberate if you're trying to get the D version of an allergy medicine, and show your ID and and all that stuff, but you can still get it. But what are some effective? And do you feel like that is a good way, or you feel like it's more of a prophylactic method?
Well, I think that what's happened now is that you have to realize that many things that are across the counter now we used to be by prescription. And so there are now, a couple of types of antihistamines, those that make you drowsy and those that don't. Those that make you drowsy are the older ones, the Benadryls, the Actadils, those are good antihistamines, but it's hard for people to function on those. So that there was many years ago, maybe 20, 25 years ago now, that people did some research and decided that they could put together antihistamines that did not cross the blood-brain barrier and did not make you drowsy. And those medicines used to be by prescription. There are three major medicines in that group. One is cetirizine, often called Zyrtec. The other is fexofenadine, which is called Allegra. And the third is loratadine, which is called Claritin. All three of those are now available across the counter. For those of you who have that kind of problem and who need those antihistamines, you go to Costco and they come in those great big bottles because they're not inexpensive medications, but they're worth every dime if you have pollen allergy. In addition to those, then there are anti-inflammatory drug nasal sprays that are now available across the counter. Probably Flonase is the most common, but Nasonex, there are lots of those anti-inflammatory agents. And you have to be very careful about nasal sprays because they come in different forms. There are both the nasal anti-inflammatory sprays, like Flonase, like Nasonex, and are like combinations like Astelin, which is a combination of an antihistamine and an anti-inflammatory. But there are also nasal decongestants. And the nasal decongestants are Sinus spray and Afrin. They're very effective in reducing nasal congestion and for a couple of days, but they have in association with them an addictive quality so that the nose becomes dependent on them to the point where you have to use them in a condition called rhinitis medicamentosa. So it's okay to use Afrin for 2, 3, maybe 4 days when you're really having difficulty and your other sprays are not effective, but they're not to be used on a regular basis because of their addiction. The other thing about the D medicines that you talk about is a lot of people can't take Sudafed. They just can't take it. It makes them too jittery, makes them irritable, makes them fussy, and some people become dependent on them. And so consequently, I would be careful to use the D only if you can't get other things involved. And so those are the two go-to medicines that are available across the counter right now. I would
take the D if I know I'm going to be outside. But if I'm going to be inside, but I feel like a little stuffy, I'll just take the regular, Zyrtec just to kind of help clear that up. But if I know I'm going to be outside and it's a high pollen count day, if I know I'm going to be outside and I'm going to be exercising where I can need to kind of get cleared up, then I'll take the D. Plus, I'm because of the fact that you have to show your ID and you could only get a certain amount at a time, I'm a little bit more conservative with how I use the Zyrtec D because I know I can't just pop it every day, and they're only good. They're only good for they're saying on the packages for 12 hours, whereas the traditional medicines are reporting a 24-hour usage, and so. It's kind of important to make sure you read those packages, but I just want to make sure that our audience understands that when they're out there, using allergy medicines, they kind of need to have instead of just grabbing an allergy medicine and just keep popping them, maybe they should seek some medical advice before they start taking the medications.
I'd like to stop and reintroduce our guest, Tonya Winders. She's the president and chief executive officer of the Allergy and Asthma Network. And let's get some questions in here. Those of you who've got an allergy problem, go in the chat room, give us a chance to maybe save you a co-payment, maybe save you a visit to the doctor as we talk about the allergy season itself. I think one of the other things that we always talk about and people are always a bit confused about is the whole issue of the allergy shots themselves. I think that they are very effective for pollen, but they're not for everybody unless nothing else works. And so we reserve them for patients who are not successfully managed with the medicines that are available. But they are very effective and they are recommended. And now you can even get or immunotherapy sublingually, but underneath the tongue. And in point of fact, in Europe, that's the primary way in which immunotherapy is given. Is by sublingual under the tongue. So those of you who suffered both in asthma grass season and in ragweed season, and the medicines don't work, and you're off from work for several days, or your kids are out of school, I think you really need to kind of get an evaluation to see if there are other things that can be done besides just taking the medicines across the counter if that's not working. And so I think that it's also been added to the protocols of the new asthma guidelines as one of the major ways in which you can treat these allergies.
Real quick, Dr. Lenoir, we want to thank our guest for joining us this evening. She's got to run, so she's not going to be able to stay with us to the end of the show, which I know is very disappointing for her. But we want to thank her for joining us this evening. And please make sure I put it in the chat box. Go to allergyasthmanetwork.org. There's no and in there, just asthmaallergynetwork.org, and get all the information you can. Also, if you have the ability to donate, to their research, donate to their cause. They have the links on there for you to be able to make a donation to the allergyasthmanetwork.org. Did I get that right?
You got it. Allergyasthmanetwork.org. Thank you guys so much for the time and the opportunity tonight. I look forward to being back with you again soon. I hope everyone stays well. Please do go. We have a wealth of free resources and programs. And then, of course, we will always welcome donations as well. So thank you for mentioning that. Have a great night.
I don't know how much. I was counting on you. Fallback position on some of these questions.
I know you have all the answers, Dr. Lenoir, so you're good. I'll see you next time around. Thank you so much.
Take care.
And we will be having the Allergy and Asthma Network on a regular basis with different topics, because like I say, asthma is our passion. So we want to get some information. We want to get your and some questions from you. We had a desperate plea from one of our people in the chat room about asthma and allergies, but we need to get some specifics so that we can maybe save you a co-payment, save you a visit to the doctor. I would like to say that there are just lots of things that go on now. One of the other things that we don't talk about much during allergy season, what we see a lot now, is we see people with hives. Hives is one of the biggest, believe it or not, hives is one of the most common things that I see as an allergist. And probably 30% of people, at least at some point in their lives, will develop hives. And so that's another category. Of course, so we can talk about food allergy. We can talk about any questions that you have, anything that you are concerned about with asthma. That's kind of going to be the style of our program. We're not there yet, but we're going to start hopefully getting a chance to answer your questions so that you don't have to wander around trying to find some place to get the resources. So you got questions about allergy? I'm not begging, you know what I mean, but I can save you a little money, maybe save you a co-payment here and there as we talk about this as a problem.
Well, there's a question. It's about eczema, and they wanted to know if there were some natural remedies that they could employ for eczema.
Well, eczema is interesting. Eczema is really not an allergy disease. Eczema is a skin disease. Mm-hmm. And for instance, if you've got spots of eczema across your body and we biopsy normal areas of skin, they're not going to be normal. What's most interesting about eczema is that it's what we call a barrier disease. That means that it breaks the skin barrier and it allows other things to get through into the skin, which ultimately can result in other forms of allergy. For instance, we know that infants who have eczema and ultimately go through something that we call the atopic march. That means that they start with eczema and there are barriers in the skin. And I used to think that infants who were sensitized to various foods were sensitized by the mother taking those foods and breastfeeding infants. But that is not the way it happens. Most of these infants start with eczema, and somehow these antigens get through the skin into the bloodstream, and that's how it happens. So once you get eczema as an infant, then you can go on to get food allergies and then regular allergies. And asthma is a relatively late phenomenon of that march through that cascade of allergy. But in terms of managing eczema, I say it's primarily a skin disease, not an allergy disease. But if you know there are certain things that make you itch, then that's where we start. Eczema is often called the rash that itches. I mean, the itch that rashes rather than the rash that itches. Because if you start scratching your skin and you have eczema in a certain spot, you're going to get some of the lesions. So keeping the skin well lubricated is the first thing we tell people to do. Not just with regular creams, Well, with creams like Cetaphil, Eucerin, Cetav, these are creams that leave a thin film on the skin, and so that protects you from having your skin dry out. You got to do anything you can to get the skin dry out. Then if you know the things that cause you to itch, and the only way you're going to really know is the journal. Your history for eczema has more validity than any test that I can do, because believe it or not, eczema is a different kind of allergy than hay fever or pollen allergy. It's mediated in a whole different way. And so skin testing doesn't tell me what causes your eczema. It tells me what causes your itching. But keeping your skin well lubricated is important. And then there are the creams that you can use. There are certain, I encourage people to use natural creams. Go to the health food store, ask the expert in those stores what creams they use to treat eczema, because so many times those creams will work. But if they don't work, then we have to start looking at the steroid creams in order to take care of the acute problem. And it's not just the steroid creams. You also have to look at the antihistamines, because it itches. People who've never had eczema don't understand how much it itches. And so you also have to use something like the medicines we talked about, like Zyrtec, like Allegra, like Claritin, to try to reduce the itching. So reducing the itching, keeping the skin well lubricated is the most natural thing you can do. Using some of the herbs and some of the non-traditional products first to see if they work and reduce the inflammation. But if that doesn't work, then we have to use the steroid creams. Now, those steroid creams are usually not in a percentage to get into the body and suppress the adrenal. Everybody's worried, if I use a steroid cream, will I get steroid problems? The concentration of those steroids are not sufficiently high to really suppress your adrenal gland and give you steroid changes. But you should use them aggressively when you need to, when you are really having bad problems. The other thing is that we have to be careful about using those creams in certain places, certainly on the face. So there are a number of creams that we call non-steroidal anti-inflammatory creams. Creams like Eucerin, creams like Allergy, creams like Protopic. You can use those on the face because they don't contain steroids, but they're often not as effective on the body as some of the steroid creams and taking care of some of the symptoms. And the other thing you have to be concerned about is when your eczema starts to open and crack and bleed, then you're set up for infections. And so you have to be careful to be aggressive about taking care of those infections. And now we have a whole nother group of medicine treatments called biologics, drugs like Dupixent that can be given to those, certainly those people who have total body eczema. Nothing has worked through the years. They just have to kind of suffer the symptoms. We now have biologics that can be used to treat patients with eczema. And so eczema is an interesting problem. It's not just a skin thing. It is an entryway into the body for a number of different allergens, keeping that skin well lubricated, avoiding those triggers, using the medicines when you need them. Then I think that's kind of the way we approach it.
We've got a question here from Rob. I'm going to put it on the screen. Rob is saying, I wear a CPAP and my sinuses get dry, and it's worse during spring, summer allergy season. What would you suggest I take to reduce the dryness, stuffiness, and help with the CPAP?
Well, I think the first thing to do, Rob, is to make certain that they're not triggers. I think you need to probably see an allergist or someone who does allergy to get some skin tests to see if there are things that coincide with your symptoms that make you vulnerable to having an allergic component superposed on the CPAP machine. The other thing is that there's something simple like nasal saline washes, the neti pots that you use at night to wash out your sinuses and to lubricate them. I think that most of the lubricants that are given for the nose don't seem to work as well, but certainly using the nasal saline washes are really pretty important, and understanding if in fact you do have an allergic component to your problem is also important. But I know the feeling. I've had CPAP in the past, and it does dry you out. Some of the new CPAP machines that use those nasal cannulas are better at that than the masks that we used to wear. So maybe getting another piece of equipment might help as well.
Well, Dr. Graham has popped into the into the building here.
Yeah, we know
Well, welcome, Dr. Graham. We were missing you. We were hoping you were joining us early, but we're happy to have you here with us on Wellness Watch this evening.
I don't know exactly. I don't know exactly what happened, but we missed you. We missed you, but you'll be the star of the show in the next 6 weeks. We're doing one of these shows every 6 weeks on asthma, and you, I promise, no matter what the mistake was, we beg your forgiveness as much as we can.
My apologies. I didn't have Google Chrome, so I had to get on my phone.
Oh yeah, that is, and we probably should have mentioned that StreamYard does not work with the Apple. What's that one that Apple uses? Yeah, it doesn't.
Yeah, that's not on Firefox. Or you're talking about Safari?
Or Safari.
Yeah.
Okay. We had other questions about either that or the vaccine or anything in our chat room that we can work on?
No, not right now, not this moment.
All right. Well, let's continue to talk a little bit about some of the other things that we see in allergy, and maybe the next time we can broaden our spectrum. We certainly can talk about food allergy. That's a very common problem, especially in young children. I mean, the foods that are most commonly an offender are milk and eggs, wheat, soy, and nuts. All of those are problems. What's interesting now, though, is that we find when I first started in practice, and this is just an anecdote, we used to feed children at 3 weeks, solid foods, to give them cereal at 3 weeks. And then, of course, the American Academy of Allergy and the American Academy of Pediatrics said that's not the good thing, and 6 months was the thing. But now we know that if you have allergy in your family, and it's certainly to foods like eggs or peanut or seafood, if you feed those components to children before they're 9 months, you can reduce the significance of the allergens.
Oh, wow.
So that's kind of a new thing. And so now we're back to feeding children solid foods much earlier than we used to. And that makes all the grandmothers around happy, because they would always say, girl, you need to be feeding that child. You need to give them something early. So now, especially in the area of peanut allergy, if you have a child with peanut allergy and you have another child with peanut allergy, and you have another child, try to get that peanut product into the child before 9 months, and you won't have as many problems. And so I think we're pretty much finished up our hour. Thanks to Ms. Winder for joining us, and thanks for those people who decided to take the time to join us. We'll be here every week, and like I say, we want to make this your program. We want to answer your questions about these issues, and we hope to do a better job with the technology, so I won't disappear for half the program. So I'd like to say to you, health is your biggest asset. So protect it. We'll see you next week on Wellness Watch. We'll be talking with the Black Women's Collective about some of the programs that they're doing, especially about the issue of the increased mortality among Black women who are delivering. So thank you, Mr. Dean, and thanks to those people who took the time to join us.
Yeah, take care.